Now we're going to do the comparison between subconjunctival hemorrhage and vitreal hemorrhage. The retinal hemorrhage, we talk about them in the diabetic retinopathy. And so here in subconjunctival hemorrhage there is a extravasated blood or hemorrhage or hematoma that is confined, limited at the limbus of the eye. The limbus of the eye would be, look, here is the eye, here is the junction between the cornea and the conjunctiva, so the hemorrhage would be only here, would be confined to the limbus. So there is no obstruction of the visual field. This presents as usually after trauma in patients with thrombocytopenia, and they could also be seen in patients with increased venous pressure, like when they do Valsalva maneuver, or vomiting, coughing excessively, or hypertensive or coagulopathy episodes. Also, if they scrub the eyes very or vigorously, we could see this. Only if we find that the patient has increased blood pressure, then we need to down the pressure. But there is no emergency in the sense that these subconjunctival hemorrhage do not obstruct the visual field. So there is no treatment that we need to give to these patients. And for vitreous hemorrhage, there is hemorrhage in the humor vitreous, and this is the ophthalmological emergency. We need immediate ophthalmologic examination because the patient presents with sudden vision loss, the defect in pupillary afferent reflex, Marcus-Gunn pupils, and the pupils would be, look, here we have the eyes. The normal is when we put light on one eye, the optic nerve does synapses on the pretectal nucleus, then this goes to the Edinger-Westphal nucleus bilateral, and from here to the ciliary muscle, and from the ciliary muscle to the pupillary sphincter contraction muscle, and there is contraction of both pupils. So if we put light on one eye, there is contraction of both pupils. If we put light on the unaffected eye, we will see contraction of the pupils. If we then put the light on the affected eye, there will be no constriction of the pupils, but the pupil will be returning from the position of being constricted to the normal position, so there would be a relative dilation, and this is called the Marcus-Gunn pupils. So the patient presents with sudden vision loss, the defect in pupillary afferent reflex, and floaters. This is usually due to head trauma, and for patients with underlying medical condition, we can give more conservative treatment. That would be the patient should be in an upright position during sleep. If we try to visualize the fundus, it would be hard. We will not see the fundus, or sometimes if we can see something, there would be obscure of the findings. So vitreous hemorrhage obstructing the visual field, ophthalmologic evaluation is urgently needed, and for subconjunctival hemorrhage there is no treatment that is needed.